You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing dentures. No more dentures. With us, we have an expert on the topic, Dr. John Willardsen. Dr. Willardsen, welcome to the program.
Thanks, Randy. Glad to be here.
Now, we had you on the program 16 years ago.
Yeah.
And back then, all you did was, I guess, do dental implants, right?
That's right.
Replace
Yep.
missing teeth.
Yep.
Same thing today?
Same thing today. Yep.
So who is the typical patient that you see in your practice?
Yeah, we've got different categories of patients. You have the patient who is running around kind of holding on to their teeth. They've maybe got gum disease, halitosis or bad breath, but they are desperately hanging on to their teeth because they don't want to lose them. And then you've got the patient and that patient would be one who's going to lose their teeth pretty much regardless. And then you've got the patients who have already lost their teeth that are wearing dentures, as we speak.
So you don't like dentures at all?
Well, to be honest with you, I don't. I don't like it because I realize for the patients who have to struggle and live with dentures, the inefficiency that they are. I mean, a denture is as efficient as playing 18 holes of golf with a putter. I mean, it's really very inefficient to try to, chew your food, talk, speak. It's very inefficient appliance to try to do all of these things that we demand from our mouth and our teeth.
So if it's so good, then what's your take? Why aren't all these denture wearers coming in to get, something locked in? A full set of teeth?
I think for the most part, they don't really know what they don't know. So, denture patients fall into a category where they're kind of off the grid or out of the system. They really don't go to the dentist unless they have a sore spot or denture breaks or something. And so they don't really know why the benefits of implants and how it would help them to be able to chew their foods. So they don't realize what they're missing. My patients who I've been able to restore their whole mouths with implants and give them a fixed set of teeth, it's a new lease on life. I mean, they're able to go out with friends to dinner, and they're no longer looking at the menu kind of, wondering, I can't eat this, can't eat that, and knowing that they're very inhibited in their...
Do they tell you that, by the way, on the consults?
Absolutely. I mean, they do. I mean, I hear all kinds of stories of situations where, I've got many patients who literally won't go out to try to find a job because they're so concerned about their smile and their teeth. And so it's important. It's a psychological thing. I mean, imagine, Randy, if you were to lose one tooth, it would be pretty traumatic. And now imagine losing all of your teeth. It is truly life-changing. And now, a lot of times patients go through this process where they go to the dentist, they get a crown, and then they get a root canal, and then so on and so forth, and ultimately lose a tooth, and then they spend so much time in the dental chair and end up essentially losing all of their teeth eventually that, they're reluctant. So
the last thing they want to do is come in and see you.
The last thing they want to do is come and see the dentist again, because in reality, they felt like once they lost their last tooth, it was kind of over. And
you call it a third set of teeth. Elaborate on that.
It is a third set of teeth. It's, you have your baby teeth, of course, and then, your permanent teeth that you get as you get older. But then as you lose those teeth, implants provide the third set of teeth. And so you get your third set of teeth that are permanent, they don't come out, and they're aesthetically, sometimes they're better than the teeth you were born with.
How it's normally done. Let me get this straight. You go to one doctor that does the surgery, another doctor that puts the tooth on top.
Right. Yeah, so patients don't really like going to multiple doctors to have one tooth replaced or have their implants placed and restored. It's more efficient the way that I do it, and because it's like an architect. When I can visualize the case before I start putting in the posts or the implants, and I can kind of follow that through the process. So at the final end result, I know where I'm headed even from the beginning. So I've got my implants that go in place. I kind of know what the final prosthesis is going to look like. So and implant dentistry is a very mechanical, technical discipline. And it requires the person who's placing the implants or the foundation to kind of have a good idea as to the end product and what it's going to look like and how it's going to function.
In the old days, 15 years ago, 16 years ago, on my show, you were referred to as the king of dental implants because that's all you did.
Yeah, still.
I reminded you of that when you walked in the studio. You said, "Don't call me the king again today," right?
Yeah.
But, well, that's good. And the public, people need to know. I'm not trying to side with you. I mean, this is a real interview. But when people ask us, who's your referral for this or who's your referral for that, I always say, look, go to somebody that this is their focus, this is their specialty, this is all they do. Because it doesn't cost more to go to a guy like you, right? Is that true?
Absolutely not. In fact, it's probably less. It's much more efficient. We can kind of streamline the cases a lot more quickly, and get to the end product. The patients want teeth. They don't necessarily want implants. They want some teeth that stay in place, that look great, and that function great. That's what I do. That's my job.
So a lot of the doctors that come on my show, we've had some, a lot of medical doctors and dentists, they do a lot of snap in, snap out teeth.
Right. Yeah.
You don't like that. Why is that?
Well, a patient who has dentures, that is very inefficient. To snap in a denture is a little bit better, but to give them a fixed set of teeth, there's just no comparison. So it's not that I don't like it, it's just I want the best for my patients. Randy, for the last 16 years of me being in practice, and I listen to my patients, and they don't want teeth that come in and out. In reality, my patients, they trust me enough to write a plan that's going to give them the most efficient and effective form of their new third set of teeth.
So what's changed, though? Obviously, you're better now than you were 16 years ago.
I have more experience.
So what's changed, maybe even philosophically, in the last 16 years?
That's a good question, Randy. One, my appreciation for the discipline and for what a set of teeth really is for a patient who no longer has their teeth, and the life-changing process that it really is. And so what has changed is the speed at which we can do this.
So you say things like where people could walk in without teeth and walk out with teeth.
Absolutely.
Does that really happen in your practice?
We, all the time we have patients that will come in, place the implants, and they leave with a fixed set of teeth that day.
How soon can people eat, by the way? And do you hear eating stories? When it's all done, they're healed up?
All the time. Just, being able to bite into an apple or carrots with your front teeth. Ask, a denture patient trying to bite into an apple, really, they probably haven't bitten into an apple for many, many years. Or to eat broccoli or a steak. I don't think you and I can appreciate what that means.
Do they call you afraid ever? Like saying, "Doc, are you sure? Am I ready to start eating?" Do they ever do that?
They will say, "Now, how soon can I eat?" I'm like, you can eat right now. In fact, in our office, we give them a gift certificate to a nice restaurant down the street so that they can try it out. So it definitely can be done same day. And as soon as they have their teeth, they can eat. It's not like in the olden days where you had to wait, a few hours because a filling or something was settling into the tooth. But today we can put the teeth in and they can eat same day.
Now, isn't it true, though, if you've been wearing dentures for 35 years, you can't. You don't have enough bone to do this.
No, not the case at all. In fact, in the 16 years of practice, I've maybe seen about 2 or 3 cases that I simply couldn't do. I could have done them, but it would have required a lot of ridge or bone augmentation procedures, very, very expensive. And the patients were at such an age that I just didn't feel like it was the right thing for them. So in reality today, 90%, 99% of the patients, we can do them. We can get implants in and give them a fixed set of teeth. In my practice, because I do see a lot of patients from other doctors or other situations, and they may have, in fact, the other day, just last week, I saw a patient who had been to 3 different doctors, had gotten opinions from each doctor, and each one had told him that he was no longer a candidate due to the fact of the bone that had receded and there wasn't enough bone there. This is a young guy. He's 45 years old. He's an engineer and running around with dentures and really kind of desperate to have these dentures replaced. And so fortunately, I was able to I have a CAT scan machine in my office, so we take a CAT scan, look at it, design the case, and within 5 to 10 minutes, I'm able to walk in and say, absolutely, I can do it. No question about it.
So then what are you doing that they're not doing? If you're able to do it and they're not able to do it?
Well, Randy, it's really about just having the experience. 15 years ago, I wouldn't have touched these cases either, but because of the years of experience and the training that I've had, I can go in and have a lot of confidence in a case like this and know that I can help this patient out and give him a fixed permanent set of teeth.
Nobody should be wearing dentures.
No.
In your opinion?
No, absolutely.
So if all the denture wearers decided tomorrow, okay, are there enough dentists to even service these people?
Probably not. Probably not.
Is that the future though? Where there won't, like dentures as we know them today, will all be attached to something?
If I have anything to do with it, you bet.
Okay, good. Well, you've been working on that, right?
I have for
a long
16
time.
years. Yeah.
Okay, so you brought some photos. What are we looking at?
So here's a patient who came into my office. Also, she was a patient of another doctor who he actually did some implants on her. He put implants kind of everywhere. And so I had to regroup. She had come to me kind of in a situation of desperation, and she was kind of tired of the whole process and really just wanted teeth. In the end, she didn't want implants. She wants fixed permanent teeth. So I was able to take a CAT scan, do all my diagnostic tools that I use, and come up with a good treatment plan that would serve her. And take a look at the after, Randy. It is
very nice.
It is truly life-changing for her, and she was so grateful that I was able to take a situation that seemed like she was desperate and within a couple of months have it fixed and have that problem or that issue just be done for her.
And they don't come in and out?
No, these are totally permanent.
Upper and lower?
Upper and lower zirconia or porcelain, upper and lower fixed set of teeth.
Now, when I first met you, you were doing a lot of snap-ins, snap-outs. And we've already mentioned that you prefer to give people fixed.
Yeah.
And that's what people want. So a fixed set of teeth, how old can you be to do this?
Well, my oldest patient is well into his 90s, and I've got patients as young as 27, so
But 90-year-old can do this? Are they more likely to fall out?
No. Well, in his case, he's got really dense bone, and he's pretty much a healthy guy, so no. They're not going to fall out, and he'll take those to the grave with him.
What foods, as far as denture wearers, because I know a few denture wearers, they never complain. Are you saying there's no such thing as a happy denture wearer?
Well, they don't want you to know they're wearing dentures, so they're not going to complain to you that, okay, hey, guess what, Randy, I can't eat this steak, can we go, over to the soup plantation? Yeah. Because that's, to adjust their diet because they can't eat, so they wouldn't complain to you, but in their mind, they're complaining to themselves. I mean, they're probably used to it at this point, but yeah.
So they've adapted.
They've adapted to it, and but if I could give them a set of teeth, like say we're going out to test drive a car, you wanted to buy a new car, you drive it, you smell it, you touch it, it's I want this car. If I could do that with every single denture patient, they would all buy the car. It's that much of a.
They couldn't go back to the denture.
They couldn't go back. It would be, they just would not be able to go back to wearing the denture. They can't test drive the implants because they have to go through the process in order to do it. But if that were the case, every denture patient would get implants.
What about pain? I mean, it does seem painful.
Well, we do all our cases under anesthesia. So some form of sedation, whether it's general anesthesia or IV sedation. So the patients during the surgery, they're comfortable and they're monitored and they're with the anesthesiologist. So it's done in a setting that is very safe. And after the procedure, for the most part, they don't remember anything that happened. And most of my patients only have to take an Advil for the pain.
Like the next day?
Yeah. But for a person to avoid doing the procedure for fear of pain is not necessary. We have so many great means of managing the pain, doing the surgeries under sedation, so they don't know what's going on during the surgery, and then afterwards having proper medication so they're not in pain afterwards. And so to avoid doing the procedure for fear of pain is really not necessary.
Do they ever say when it's all done, I should have done this years ago?
Every single one of them.
Every single one of them, yeah. What else do they say?
They just, I've got a great video that I show some of my patients of different patients and the reaction of when I put their teeth in, finally get it done. And it's tremendous. If I could document every single case, I could write a book on this because it's so amazing.
A book on dental implants?
A book on the life-changing process and
good.
the beauty of teeth in our mouth. It's a system that is so intricate. It is so, and it's so important. I mean, it's the beginning of our digestive system, and you know, a lot of times we don't think much about it, but it truly, patients who have lost their teeth can relate to what I'm talking about. And they can relate to the fact that it is, when it's gone, they really miss it. When they get it back, they're so elated.
So on the consultation, patient comes to you, either they're trying to avoid dentures, right? Their mouth's a mess, or their denture wears. What do they ask? Like what?
Of course, you know, how long does it take? How much pain is involved? Am I really going to have fixed set of teeth?
Are they skeptical about that part, by the way? Like if they say, are you sure I can do this?
I think they don't know what to expect. And so they really do put a lot of trust in me and what I'm going to give them when this is all finished. And that's another area that I really take pride in delivering the goods and you know, really giving them something that they can feel good about when it's all finished.
Now you brought a video clip of a patient. What are we about to see here?
Okay, so this is a patient who literally was, you know, such a sweet lady, and she was basically cooped up or trapped in her room. She did not want to go out. She didn't want to face the public. She didn't want, I mean, can you imagine, you know, living in this kind of, I don't know, I guess it's kind of a prison kind of in a sense, it's kind of a prison because of her teeth. I had no idea the emotional power behind our mouths and our teeth and our smile.
So they confide in you on the consult? Like, hey, I don't even like to go outside?
It took me a couple of visits to kind of break down to where the mom actually, you know, kind of expressed to me how distraught her daughter was. So, you know, this is a very good representation of really the process and why I'm so passionate about it, because yeah, there's a lot of technical details, Randy, and I could get into all those details if I could bore you to death. But in reality, why am I so passionate about this? It's because of this video and the reaction that I get on a daily basis. So before I show the clip, this is a young woman, and she's in her 40s, wearing dentures. She's got more than half her life left to live in dentures, and she doesn't need to. And so even if you're 80, you're too young to wear dentures. So take a look at this clip, and it gives us a really good impression of what this process entails and how it changes people's lives.
Okay, good. Let's take a look.
And they don't pop up.
I didn't even stick my tongue out.
Yeah, but you did that before they
What do you
popped
think?
up.
Oh, they're gorgeous.
Absolutely
Gorgeous. Thank you so much.
It's very moving.
Wow, very, very nice.
Isn't that
common?
amazing?
Is that a common reaction?
That's so common. I wish I had GoPros in my office that, you know, 10 years ago and would be able to create a library of situations like this, because it's very common. When I put the teeth in place and the patients are finally done, I mean, I get this reaction all the time.
What did they say at the end? There was some conversation. What did they say?
Well, you know, basically the mom is saying she's grateful because now her daughter isn't crying every day because she's, you know, feeling so bad about her teeth and her dentures and the whole gamut of a situation, of a patient who's wearing dentures.
On these consults, when people are coming in because they're skeptical or, you know, have a bad set of teeth, right?
Yeah.
Do you ever get excited and say, this is going to be good?
Oh, yes. And thank you for asking that question, because I get so excited when I look at their CT scan, meet the patient, listen to their concerns. You know, I try to play it down a little bit, but I know where I'm headed with this. And it's like, it is so amazing. And when it's finished, and the same feeling I had when I met the patient and how excited I was without really expressing it to the patient, and when they get that, I get the reaction that I knew was coming, it's the greatest thing ever. That's why I love what I do.
Do you ever get, after all these years, do you ever get choked up? A little bit?
You know,
because they're so happy?
I do. One, because I feel like I was part of that process, and I now have a bond with this patient, this person, that is, it's a great thing, and it truly is. It's, I don't know in what other discipline, whether in medicine or in plastic surgery or even in dentistry, where I could gain the same level of satisfaction of life-changing process. It really is.
So
it's
eating,
amazing.
chewing, laughing.
Eating, chewing, laughing, smile. You know, our smile is the number one thing people look at. Our smile and then our eyes. And so, you know, if I can take a person who has literally been avoiding smiling, covers their teeth when they smile, tries not to smile, and all of a sudden, without hesitation, they're smiling. And there's no inhibition. They're not holding
charisma.
back.
They have charisma now.
Yeah,
almost.
absolutely. And what other area of medicine can we give this back? It's amazing.
Okay,
It's
good.
awesome.
So you're lucky
I'm very
to be
lucky.
doing what you're doing. Okay, you brought more photos.
All right, so this is a patient who had some dental implants at another office, and
Oh my goodness.
needed implants on the upper. And so a case where I, you know, again, had to kind of regroup and figure out, okay, how am I gonna, can I utilize any of these implants? Fortunately, I was able to use some. Some had to come out because they had some bone loss and some issues. But take a look at the after, and he has a full set of teeth, fixed upper and lower, and doesn't have to worry about he can eat anything he wants. And this was a patient who was holding on to the uppers because he knew they were going to have to come out, but he was holding on to them for dear life, just hoping.
Isn't it true, though, if you have gum disease or bad gums, you're less likely to be a candidate for this procedure?
Actually, Randy, the teeth are now the problem. So they've got bacteria and the gums are inflamed and there's infection. So by eliminating the teeth and cleaning up the gums, they turn nice and pink and healthy after we've removed the teeth and put the implants in. So actually, no. So if they have gum disease, this is the ideal treatment for them.
And you're doing this in one day. I mean, in the same day.
Yes. Yeah.
Is that
same
right?
day. Yep.
And but now, because I talk to some dentists, and they say, well, Randy, you got to wait about 6 months. You got to wait a little longer.
Yeah.
That's true, right? I mean,
That we put the implants in and load the case in the same day.
same day.
Yeah.
But there are dentists. My point is, there are dentists that are doing it, I guess, according to you, the old-fashioned way.
Yes.
That means they're
absolutely.
lengthening the procedure.
Yeah.
Why? So are there like struggles in dentistry over which is the right way to go?
A little bit, you know. Really, it's a matter of I think it's a matter of experience and just knowing what in each case the tolerances of the design of the case and how it's designed. And it's kind of so many details. It would take another long, boring show in order to.
Because you teach other dentists this, right?
Yeah.
At Loma Linda.
Absolutely.
But the main message, I guess, is if you're wearing a denture, or if you're trying to avoid false teeth because your mouth's a mess,
Yeah.
you could go in and in one day walk out with teeth that don't come in and out.
have a fixed set of
It is hard to believe. I mean, aren't patients skeptical? Don't they say, Dr. Willardsen, are you sure?
For the most part, they're relieved.
not.
They're relieved, you know, to know that finally they've got an answer to a problem that's been kind of lingering in their mind for many, many years.
Okay, good. And it doesn't have to really hurt, you say?
No, it doesn't.
Pain should not keep you from doing this.
Absolutely not.
Okay, good. And now you have more photos, so we have to get to those photos because we are out of time. What
Okay,
else
so
do you
here's
have?
another patient that had, you know, went to one of those places that give you snap in, snap out, or mini implants, and so by the time she got to me, she was frustrated because the snaps, if you get any debris in them and try to put it in, they don't seat, they don't fit into place, they have to be adjusted all the time. And take a look at her after. A fixed upper, fixed lower, and it's done. She doesn't have to worry about snapping them in, snapping them out, making sure they're clean enough so she can snap them in. And so you asked, do I like the snap in, snap out? It's not about like, it's a matter of giving the patient what's most ideal for them, given their situation.
Well, it makes sense. I mean, people
it just
want
makes
teeth
sense.
that don't come in and out.
That's right.
So what's the maintenance like after that? Once they get there,
It's like having your own teeth. You got to brush them, you got to floss, and you just got to go back to those routines that you had, or maybe not had, when you had your natural teeth. So now all of a sudden they're back in the system. They've got to come to the dentist, get them checked every 6 months, have them cleaned, and so they feel good about themselves again. They're confident with their smile. They can eat whatever they want, and all of a sudden we've given them a new lease on life.
do they ever hug you?
All the time.
When were you going to mention that?
I don't know if it's because I'm so good looking or if it's because they like their teeth. But.
When were you going to mention that your patients hug you, right? I guess there's few things you could do in dentistry where they want to give you a hug. Is that right?
Yeah, that's true.
Like they're very grateful.
Yeah, it's an amazing process, and my patients they're like family. You know, they truly are. I get Christmas cards, I get thank you cards all the time.
And by the way, this is in your blood, literally. Father is a dentist. Your brothers are all dentists.
Brother-in-law, uncles.
Your sister's married dentist.
Yeah.
Is this true?
Yeah.
I mean, so when you go to family gatherings, you guys are all talking about.
It's pretty boring, Randy.
But you talk about you talk about implants, your cosmetic dentistry, brother.
So we need some other hobbies, I guess. So.
That's good that you like that. Time for one more.
Okay. All right. So again, patient comes in, and
oh boy.
You know, this is a situation where the patient has had a lot of dentistry. I mean, if we could quantify or count how many hours this patient's spent in the dental chair, it would be enormous, and how much money they've already spent. And within, 1 day procedure to have them walk out with a fixed set of teeth. Again, it's that level of just giving them a kind of a relief from what they know, but what they didn't know. They didn't know what they didn't know. So it's, it truly is a life-changing procedure.
Okay, good. We're out of time. Great stuff. Final message to somebody that's still skeptical or afraid of the dentist, but they know they don't like their denture, or they know that they're headed for false teeth. What do you say to them?
Yeah, if they're wearing a denture, first of all, let's talk about them. Don't hesitate. It truly is a process that will transform and change your life.
Call the office, and you still see patients?
Absolutely, yes. So give us a call. Check out my website, trustimplants.com, and you can ask a question on my website. If it's if you want to be discreet about it, I'm happy to answer directly, and I answer all those emails and calls. Yeah.
All right. Thanks for coming on the show.
Right. Thanks,
Always
Randy.
a pleasure.
Appreciate it.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.